Reena Sethi, the director and the co-founder of the Charitable Trust, to give a presentation on how to simplify cataract surgery in medical missions. So this will be useful for the young doctors here. So before that, ma'am, can you introduce yourself because you came late? Your name and where you come from?
Oh, okay.
You're an Afrikaner?
Okay, great. Welcome. You'll see a lot of South Africa mentioned in the presentation because that's where we had gone for our medical mission. So I'll just be talking about simplifying cataract surgery in medical missions. So basically, we all know that cataracts are a leading cause of blindness all over the world, and it's particularly prevalent in countries where healthcare is not sufficient to meet the load of cataracts. And the medical mission does play a very crucial role in helping out in reversing this tide of blindness. Because what happens is that we, as doctors, when medical mission comes in, you're giving technology and you're coming with a purpose. You're coming with a purpose of, operating on patients who have cataract, and then you do that. And in that way, you're also training the ophthalmologists who are in that country or that area. So before doing all that, it's very important to plan it. And in the planning, the most important part is to understand what are the local resources and what are the local needs. If you're going to start selling ice cream in Antarctica, it's not going to be a success. So we really need to know what is the requirement of that area. And the area should not be selected because we have to visit that area. Oh, I would love to, go there and enjoy a vacation, because it's not going to be a vacation any which way. So conduct the survey or questionnaire you can give to the local team and find out what exactly is the prevalence of cataract and what are the available healthcare infrastructure that is there. You need to coordinate with all the local healthcare authorities, especially the NGOs who've been working and conducting the camps and seeing that there are so many patients. So you must have an idea how many patients you're going to be treating. And you need to know what are going to be the supplies of equipment and your machines, what exactly it is. And so you prepare yourself accordingly. So is it just going to be no machines, or is it just going to be the instruments that you have to carry? Always better to carry your own instruments as well, because sometimes, you maybe you need a particular kind of a forceps or a rexis forceps, and that's not available, and it is going to bring down your efficiency levels also. And the intraocular lens support should be good. You shouldn't be wasting the time, finding out what lens is required. So basically, you need a good support system when you're doing this. And a team formation is very important. When we had gone down to South Africa, at the thing was that we went into a hospital, the J.J. Crookes Hospital, where the team had never done a cataract or any ophthalmic procedure before. So it took us about almost half a day to explain to them how the workflow and the pattern is going to be. So that is very important. And you needed a team. You needed the head nurse. You needed somebody to keep autoclaving your instruments, giving it to you, and the movement within the theater. So it's very important who all are going to function, where, what position, all that has to be worked, and all depends on the number of surgeries you're going to be doing. So you have to provide the training and the orientation to the staff available. So don't put up your hands and say that I probably will not be able to do it, because you have to make use of what you get in the best of your ability. So also be very careful about all the cultural sensitivities, because sometimes it's just the women have to be treated in a particular way, the men have to be spoken to another way, and what are the cultural sensitivities in that area is very important to understand. And patient screening and education. So the patients have to be in the awareness campaigns have to be done, and these patients have to be given the education as to what procedure is going to happen to them and what is expected out of that procedure wise in that local community. And also who are, whenever they're doing the camps or screening clinics, the patients who are at the requirement of cataracts, especially I think you should focus on patients who are bilateral advanced cataracts or they have advanced cataracts. If there are too many patients, then give them the priority, so that at least your efforts are going to make the best to that particular patient. Patient education on procedure and post-operative care is utmost important, because you need to gather them all together and explain the pre as well as the post-operative care before you start your surgical day, because maybe by the end of the day you may not have enough time to explain to everybody. So you'll recognize this. This is in South Africa. So the first day when we went there, we had patients from the Rotary, and they were the Africans who have cataract. The second day, they were the other patients who had come from the Lions Club. And then we had the last day, there was this Satya Sai, and there were a lot of Indians who had come for the third day. They had been screened from these different camps which had already got together. So it's important to sort of see them, mark the eye, very important. The lens has to be separated out. So this kind of a duty has to be delegated to one of the technicians or helper, whoever is going to be there with you. And the surgical stepwise has to be very, you have to focus all that. You have to create a sterile operating environment. That's very important, especially if you're going into a place where they've not done ophthalmic surgery before. All the more reason that you need to set it up properly and explain the workflow to the people, and how you want the instruments to be, rotated and autoclaved. So best always is to carry at least 6 sets of instruments per surgeon, so that you may giving it for the re-autoclaving and getting it back. That way you don't have to wait for the instruments. And if you can get 2 tables like I did, so you can just swing your microscope between the 2 and use the same machine, which was this time, I think that time it was the Alcon machine that was donated to us for that particular period. That is going to optimize your workflow and your efficiency. So just set up all that before you start. And what exact technology you're going to do. Don't try newer things on camps whenever you're doing these volunteer missions. If you're comfortable with SICS, the manual surgical technique, just do that. If you're comfortable with the phacoemulsification and you have the setup for it, just do that. Don't try new things, because that is not going to be very productive. So here's the organizing, setting up your various nurses and telling them this is your duty and this is what you have to do, and keeping everything sterile. So they already have 2 trolleys ready, and one is already there with us. So we have to see that the first thing, far most important, is the patient safety and your efficiency. These 2 things have to be very important. So just your surgical procedure should depend on that. And of course, in these high volume, if you don't have enough support, it has to be cost effective. Option cataract surgery has to be considered, because sometimes the IOLs and all that becomes a bit of a challenge. You don't get foldable lenses for all the patients, so you can always go for PMMA lenses as well. Implementing the quality and the control measures are very important. So monitor your surgical outcomes. So be very careful. So try and see the first day operated, the next day, and so on and so forth, so that you can see that your results are good. So here's my staff nurse. She was very helpful. She was very efficient once she got the hang of it. And here's Dr. Arun Sethi and Dr. Webhoff. They were doing SICS, and they had 2 tables. They had 1 table each. I had 2 tables to this thing. And the manual small incision cataract surgery is important, because it's a low-cost surgical procedure. It's suitable for all types of cataract. Sometimes phaco, we always have a problem with very soft cataracts or very hard brunescent cataracts. So it is ideal for high volume setup like cataract surgery missions. So if you know how to do a MSI, small incision cataract surgery, I think it's a big advantage. And efficiency outcomes of similar to phacoemulsification over a longer period of time. And the post-operative care is important to be explained to the patient, monitoring the patient closely for complications. So the next post-op day, just try and see whether you have a problem or any issue, or the patient is unhappy, pain, pressures, all that have to be monitored, and explain to the patient what exactly is his goal now from onwards. And you have to address all the logistical challenges of follow-up care. So maybe you need to explain to the local ophthalmologist for follow-up cares as well, which is very important. You can't leave the patient like that after operating. Educating the patient in long-term eye health is important as well, so that they're also able to inculcate or check the eye health, like Dr. Arun was talking about the e-chart. So make them aware of eye health as well. That is also part of your mission. So here's all the patients waiting for their post-op, checkups. They've been operated, and they're all waiting for that. And again, it's important, capacity building and sustainability is important. You have to train the local healthcare providers also. This is very important, because you go there and you come back, you made that effort, you need to train somebody also. So have all the local ophthalmologists, whoever want to help in, pitch in, be with you, so that you can give your tips, your way of working as well, and maybe invite them over to your area also eventually. So you need to support the infrastructure as well. So evaluation, adaptation is also important. You need to find out what exactly were your outcomes, what were your learning experience, because every time there is something to learn whenever you go in these missions. And in conclusion, an efficient cataract surgery and medical missions are essential for addressing blindness in developing countries. And medical missions play a crucial role in providing essential eye health services to the underserved communities. Encourage ongoing support for the medical missions and initiatives aimed at improving access to the eye care services worldwide. Thank you very much. So here's our team. There's a local ophthalmologist also with us, and a good successful mission was conducted. Thank you.
Thank you very much, Dr. Reena. It just shows how close South Africa is to the heart.